Tent dining on the street, outdoor haircuts, and takeout food. These are all some of the things that we have adapted to for nearly a year now. And many of the businesses that offer those services are struggling to survive while others have gone under. So when the state says a business must close or stop selling alcohol or move its operations outdoors, how are those decisions being made? The answer is unclear. KCRA3 Investigates has been trying for weeks to better understand how this process works. And as you'll see in this report, the state has been slow to provide answers. Governor Newsom has said from the beginning that science and data would drive California's decision-making during the pandemic. Nail salons, restaurants, bars, hair salons, all these businesses have either been forced to close at times or had their operations restricted as a way of slowing the spread of the virus. So what do the science and data say about the rate of infection at those businesses? The short answer is we don't know, and the state of California tells us it doesn't have the information. In early December, 2 months ago, New York Governor Andrew Cuomo announced that 1.4% of all COVID infections in his state were being traced back to restaurants and bars. 1.4%. As for gyms and salons,
gyms are one of the lowest known spreaders now by the facts. We've increased the testing. We've reduced the capacity. Gyms are now down to 0.06. Hair salons, barbershops, personal care, 0.14.
Days after that soundbite from Governor Cuomo, KCRA3 spoke with State Senator Patricia Bates of Laguna Niguel about an effort to have restaurants reclassified as essential businesses. Listen to what she said about the data.
Give us the statistics. What is the percentage from contact tracing that's leading back to restaurants? And they have not produced that. And there's been a lot of discussion about that, even from our public health officials, that they don't have those statistics or that data.
Immediately following that interview, KCRA3 Investigates emailed the California Department of Public Health. We asked for contact tracing data for these businesses. Simply put, we wanted to know to what degree are they contributing to the spread of COVID-19. The health department told us the records are not readily available and CDPH needs time to gather and review the requested records. That was back on December 16th. Since then, we've received email updates from the health department on January 7th and again on January 21st, letting us know that they are still in the process of locating and reviewing the records. California has hired thousands of contact tracers, people whose very job it is to figure out where a person was infected so that others know if they have been exposed and need to quarantine. The whole purpose of contact tracing is to know where infections are occurring, but as you heard, according to the state, the information is not readily available. The state health department is processing our request for this information under a Public Records Act. However, because of the COVID emergency, it's not clear when or if the state will provide the data. We're scheduled to get another status report from CDPH in less than 2 weeks.